So the president's about to speak from the Oval Office. There was some reluctance that has been overcome by the networks as to whether or not they would carry it, but all will carry it tonight. His argument is likely to be about the threat that he believes is posed by illegal immigration. A very different message tonight that is coming from the coasts in New York and California. Proud proclamations that all residents, including hundreds of thousands of people who are here illegally, will get health care coverage from the government, also known as the taxpayer.
Health care is a human right. In this city, we're going to make that a reality. In this city, we're taking that ideal and putting it into practice. From this moment on in New York City, everyone is guaranteed the right to health care. Everyone.
Joining me now, Mark Thiessen, American Enterprise Institute scholar and Fox News contributor, and Wendy Osefo, political commentator and education professor at Johns Hopkins University. Welcome to both of you. Good to have both of you.
Good to be with you, Martha.
Here tonight. I want to take a look at this from Gavin Newsom as well, because there's a similar sentiment here. Let's watch that.
Faraway judges and politicians may turn back our progress, but we will never waver in our pursuit of guaranteed health care for all Californians.
The big question here, Wendy, and Bill de Blasio, the mayor of New York, sort of dodged it a bit and said that it would be paid for, I guess, under existing programs. But who pays for all this coverage? Hundreds of thousands of people who are here illegally.
Yeah, and I think what he's trying to do here is he's trying to put a Band-Aid on the leaking faucet, because the truth of the matter is the New York City health system has been in a deficit for years because they've been paying for ER visits for the uninsured. What's happening here with this new initiative is they're trying to say we want to give people access to primary care providers as well as specialty providers, instead of saying that the emergency room will be your first entryway. So, my sister, she's a surgeon. She agrees with this as well. And I think that what they are trying to do is they're saying we're going to spend these millions of dollars, but we spend them anyway when people go to the hospital and they don't have insurance. And quite frankly, as an American, as a taxpayer, I'd rather our government spend millions of dollars for health care for individuals than them spending on something frivolous, like, let's say, a wall. But that's just my personal opinion.
That was the last segment. But anyway, it's an interesting point, and it's also going to include mental health care. But his argument is that preventative care, essentially, allowing people to go to doctors, will save taxpayers money down the road when they have a big medical problem and they show up at the emergency room, Mark.
Yeah, well, that's also what they said before they passed Obamacare. And guess what happened? The year after they passed Obamacare, emergency room visits skyrocketed to record numbers because people felt now that they could show up and they didn't have to be embarrassed because they had an insurance card, so they could show up at the ER. So actually, the record is the opposite of what Wendy said. The ER visits increased and the costs skyrocket. But here's the thing: the problem with this, Mayor de Blasio says that this is going to cost $100 million. If you believe that, I've got a bridge in Brooklyn to sell you. It's not going to cost $100 million because what's going to happen is this: people from all over the country are going to flood into New York to get their free health care. And here's why: because they're offering it to illegal immigrants, or as they like to call them, undocumented immigrants. Undocumented immigrants are, by definition, undocumented. So therefore, you cannot ask them for proof of residency. You can't ask them for proof of income. They are undocumented immigrants. So if you offer free health care, paid direct single-payer health care to undocumented immigrants, by definition, you're offering it to everybody. So and this is good. That's going to blow the costs through the roof, way over $100 million. So my advice to New Yorkers is move over to Hoboken, so you don't have to pay the taxes that he's going to impose on you, and then come across the river on the PATH train to get your free health care.
I got to leave it there. Thank you both. Great to have you with us tonight. All right.
Thank you.
I lived in Hoboken and New Jersey, so anyway. Coming up next, what we might learn